Kia ora. Again, it's me and the knee. I feel like it's my new little name. Rename everything. My little mental journal log kind of stalled there for a couple of weeks ish. I don't know, time's passing very slowly. But I hadn't really done like a mental journal for a while, and I've had a lot of things going on, a lot of things to think about, and I feel like this is just a really good way for me to try and remember things, because so much is happening, and this is something that I am going to want to look back on one day and think, oh, look how far I've come. And I think having that incentive of one day looking back on this period of my life and remembering how awful it is, could be really helpful. And I've had some lovely people reaching out and offering suggestions and tips and things to try, and that has been amazing. And in no way is this aiming to be like a pity party. I've been throwing many of those for myself lately. This is just my verbal diarrhea of what my brain is going through right now, and kind of a bit of progress in what's happening with my leg. So had to wait a few weeks for the follow-up with my specialist, because they were sort of umming and ahhing whether they needed to do surgery again on my leg. The top of my tibia wasn't really flush, and there's a bit of bone that's kind of dropped down, sunken down. Basically my knee was shattered. Let me get back in focus. Shattered into lots of little pieces, rather than just like a straight break. My specialist used the analogy that it was like a cookie that you smashed with a hammer and shattered into lots of little pieces, which isn't great for a bone that's primary weight bearing. So the little chunk on the side that he was kind of worried about, the CT scan showed that it isn't really in the right place, but he doesn't think it's going to impact on weight bearing. The meniscus tissue will actually just kind of pad out the top of that tibia. So basically, he doesn't. If I have to have surgery again to try and readjust that bit of bone, it's going to be a really big ordeal, and he doesn't think he's going to be able to get it into any better of a position, which solid news. So the consensus is start partial weight bearing and see how it goes, basically, and any issues I'm sure are going to arise as soon as I start to actually use my knee. So I'm seeing him again in 6 weeks, which is 5 weeks from now, because I saw him a week ago. And my physio is super stoked, because she's like, we actually start doing some actual things, which I was so excited for. I was just like, yes, let's start walking, let's get the show on the road, because my existence has just been sitting and passive muscle activation, which is just awful. So I was really like, yep, let's get going, let's get these muscles coming back. And I was really shocked as to just how hard this is going to be. It was a huge reality check of shit. Oh yeah, sorry for the swear words. Putting my foot on the floor has been such a tentative thing, because in your brain, you've basically been training your brain this whole time, don't use your foot, don't put your leg down, don't do anything, to then go, okay, yeah, you've got the all clear, start putting 10% body weight through it. And you're like, well, I have to try and put weight through this leg that I've been told to not do anything with, and that in itself is a huge 360. And I have zero trust in my knee. I have zero faith that this rickety old crumbly cookie of a leg is actually going to hold out. So I ended up stepping on the scales with my foot to actually see how much 10% is. And it's lot, much more than I was actually doing. So I have to try and like step more. And I'm finding that my knee feels really wobbly. It feels really insecure. I can barely put my whole foot on the ground flat as it is. It's mainly just like the front half of my foot. So I'm basically like wearing a high-heeled shoe just because my Achilles and my calf are so tight just because there's been no load going through it. So yeah, it's definitely a big reality check of how intense this rehab is going to be. She got me on a bike for the first time, which meant going up to the gym in my physio. So I had to go up a flight of stairs on my crutches, which is about 20 steps. So the most amount of steps I've ever gone up with my crutches. So I was already pretty knackered by the time I got up there, and had to sit on an exercycle and basically did like a third of a revolution with my foot, and it's just really hard trying to get any sort of fluid movement. It feels really jolty and uncomfortable. It's obviously very, very stiff, like in my knee itself. So yeah, I'm waiting for a little mini cycle to kind of arrive so I can do like little revolutions and then kind of work up to using the bike. Watch this space. Yeah, at the minute my exercises have now changed. I'll show you what they look like. So this is my leg as it stands for now. It's very little. I can actually get my whole hand around, or two hands, so I say around, which comparatively there's a bit more muscle on this leg. The scars are healing pretty well. I don't know how well you can see that one. So at the minute, then my main exercise is, well, I can get about this much flexion through my knee just sitting on the side of the bed, which is good progress for me. So at the minute I'm doing leg raises to try and engage my quads, but I'm having quite a lot of pain in the knee just with that fluid motion. And then I'm doing some calf raises like so, trying to get my little calf working, and then I'm doing some hamstring activation, so trying to get some muscle activation through the back here. Yeah, the muscles feel really obviously very weak. There's a lot of the jitteriness with the movement just because there's been so much atrophy. They've just not been used, and they feel like they're almost on the verge of cramping, like they feel really angry. So that's fun. So I'm doing those exercises. I'm doing them religiously, like at least 3 times a day, just kind of as I remember, basically, just to try and, you think how often you use your knee, like how often you use your leg just with walking or sitting or anything, and just them existing and doing nothing, no load or anything going through them is a big adjustment. So yeah, that's pretty exciting. I'm trying to, any recommendations on stuff to put on scars? I've got a couple of things that I'm putting on. One of them is this pure vitamin E super concentrated oil. It's a Plunkett Vita E, high potency. So I'm putting that on, and then I'm also putting on some cocoa butter skin therapy oil with vitamin E too. I know most of it's probably just like a fad, like it's probably, I know there's no real scientific evidence that putting these things on can help, but I am desperate. I will try everything. I've also got vitamin E capsules that you can take orally, and was told that you could actually pierce those and put the oil on, but it says to not take them when you're on anticoagulants, so I'm still on aspirin for a few more days, so I'm gonna just hold off taking those. But I'd be interested to hear if anyone's got any like recommendations on stuff to put on the skin. So yeah, that's the update for my leg. I'm seeing the specialist again in 6 weeks, like I said, just to review things, and I'm seeing the physio again on Friday, so she's gonna trial out a few little braces or little like support sleeves, I guess, to put on my knees, because I'm not wearing my ROM brace quite as much anymore, which is daunting. But just to have some extra stability going through my leg would be helpful, physically and mentally. So hopefully I'll have those on Friday. And yeah, I'll endeavour to try and do a few more of these, because, like I said, the old verbal diarrhea is good. But yeah, that's it. Signing out.